Good morning, everyone, and welcome to today's update on the investigation of an undiagnosed neurological illness in the province. Bonjour à tous et bienvenue à la mise à jour.
Good morning, everyone, and welcome to today's update on the investigation of an undiagnosed neurological illness in the province.
Matin, le médecin hygiéniste en chef.
Joining us this morning, we have Dr. Yves Leger, Chief Medical Officer of Health.
Officer of Health. The format for this morning's update is as follows. Dr. Leger will deliver some opening remarks, followed by questions from members of the media. Voici comment nous allons procéder.
The format for this morning's update is as follows. Dr. Leger will deliver some opening remarks, followed by questions from the members of the media.
Good morning, everyone. Bienvenue à tous. Thank you for being here. Merci pour être ici. So my name is Dr. Yves Leger. I'm the province's Chief Medical Officer of Health. I'm here today to provide you with information on the investigation into cases of undiagnosed neurological illness in the province that's being led by my office in support of or with the Vitalité Health Network, as well as the Public Health Agency of Canada. Donc, je suis ici aujourd'hui pour vous donner une mise à jour sur l'investigation.
I'm here today to provide you with information on the investigation into cases of undiagnosed neurological illness that is being led by my office and has been supported by both the Vitalité Health Network and the Public Health Agency of Canada.
They could speak specifically to their collaboration and support that they've been providing us on this file. They were certainly very eager to be here today as well to speak to that. But since the federal election has been announced and the government's now in caretaker mode, unfortunately, they are unable to join us today. Nous avons invité nos collègues de l'Agence de la santé publique.
We had invited our colleagues from the Public Health Agency of Canada to join us today so that they could speak specifically to the collaboration and support they have provided on this file. They were certainly eager to participate, but since the federal government is now in caretaker mode, they are unable to join us.
Including affected patients and their families are concerned about this issue, and so are we, which is why I'd like to cover a number of aspects with you today on the work that we've been working on or conducting. In today's update, I'd like to give you a bit of history on the file in terms of what we've done to date, give you an overview of the work that's been going on this investigation, outline the next steps that we are going to be taking in this investigation, as well as outline some of the timelines as well, and when you can expect to receive further updates. Je comprends.
I know many New Brunswickers, including affected patients and their families, are concerned about this issue, and so are we, which is why I'd like to cover a number of different aspects of this work with you today. In today's update, I'd like to give a bit of the history on this issue and give an overview on the work that's been done to date. I'll also outline what the next steps are in this investigation, as well as some timelines around that work, including when and how you might expect to get updates.
Cases of undiagnosed neurological illness in New Brunswick started back in 2021 when Public Health studied a group of 48 patients with undiagnosed neurological illness. At that time, we put in place what we called an oversight committee, which was essentially a group of 6 specialists, a group of practicing neurologists in New Brunswick, who were tasked with reviewing the clinical files and details on these patients. They provided their professional advice and recommendations to each of these patients' physicians on further investigations that may be required. Once they'd reviewed all the patient files, they also weighed in on whether or not they felt that these patients or a subgroup of these patients might be suffering from some sort of common illness or a similar disease. And in their professional opinion, they didn't feel that that was the case here. À ce moment-là, on a mis en place un comité de surveillance.
At that time, we put in place what we called an oversight committee, which was essentially a group of 6 specialists, 6 neurologists from New Brunswick who were tasked with reviewing the clinical files and details on these patients. They provided their professional advice and recommendations to each of these patients' physicians on potential investigations they might consider. Once they'd reviewed all the patients' files, They also weighed in on whether or not they felt that these patients or a subgroup of these patients might be suffering from some sort of common illness, a similar disease. And in their professional opinion, they didn't feel that this was the case.
And efforts to understand what that might be and what the cause of that illness might be as well. We would have brought together various experts from different fields of expertise to explore potential causes. We would have also sought further resources and further funding to support additional investigations and research to explore those causes further. Given the findings from this expert panel that did not suggest a common illness was present, that follow-up work was not justified at that time, and the investigation concluded in 2022. Now jumping ahead to early 2023, the same physician who reported on those initial 48 cases reached out to us to bring forward new concerns to our attention with respect to some of his patients. He had actual test results suggesting elevated levels on some environmental substances, more specifically heavy metals and pesticides. At that point in time, he also indicated he had 147 patients that were under investigation. He reached out to us to help him understand what was happening with these patients. Given the concerns he raised, which were also concerning to us as well, we certainly agreed to do that. It was with that in mind that we defined the main purpose of our investigation and objectives that we embarked on in 2023, which was to further understand the concerns brought forward by the physician with respect to certain environmental factors. Si on remonte au début 2023,
So jumping ahead to early 2023, the same physician who reported on those initial 48 cases reached out to us to bring new concerns to our attention regarding some of his patients. He had actual test results suggesting elevated levels of some environmental substance, more specifically certain heavy metals and pesticides. At that point in time, he also indicated there were 147 individuals he was investigating. He reached out to us asking to help him understand what these findings meant. Given the concerns he raised, which were also concerning to us as well, we agreed to help him with that. It was with that in mind that we defined the main purpose of the current investigation we embarked on in early 2023, which was to further understand the concerns brought forward.
with these patients, we need data, we need information. To help us define and collect the information we would need to help answer those questions, we prepared what we called an enhanced surveillance form back in early 2023. This two-page form was meant to focus the information that was crucial for public health to review, to be able to help better understand what was happening and be able to provide him and his patients with answers. Now, these enhanced surveillance forms are not necessarily new to public health. These are tools that many jurisdictions across Canada and elsewhere use on occasion when we need to collect additional information on an issue that's of concern. Sometimes they're completed by physicians, sometimes they're completed by public health staff, and sometimes by both. This form was finalized and shared back with the physician in May of 2023, and he's worked on getting some of those forms completed and sent back to us since then. Now, during the summer months of 2023, the physician did indicate to us that this was a lot of work to complete, especially since he had over 200 patients that he wanted to report to us at that time. We agreed with him and decided that we would provide him with support to work on the backlog of patients that he wanted to report back to us. And so since that time, we've been working to complete the collection of this information so that we can better understand what's happening and help provide him and his patients with answers. More specifically, we've completed the following activities to date. We started by what we call a scoping exercise back in late summer of 2023. This is really meant to help us understand the type of information that's being collected on patients, the format, and how it's collected. This helps us plan for how we can go in and collect the actual information in an efficient and complete manner. Once the scoping exercise was done, additional work was completed to take paper-based files and put them in a digital format and prepare them for extraction. That work was completed in the fall and winter of 2023. Then we went back to his office to complete the actual extraction of the data and place it in a database. That work occurred in March and April of last year. This support has also involved staff going directly to his office on numerous occasions to complete these activities. Since completing those last steps I've just mentioned, what we've done is we've prepared and put together the data we've collected into packages. We then provided these packages to the reporting physician for his review and sign-off. Those were provided to him in May of last year, and we've been working with the physician along with his employer, the Vitalité Health Network, to support him in completing this task since then. So as you can see, there are a number of different steps that have been involved in completing this work. Having said all this, I do want to highlight that we've not been doing the work alone, far from it. We've received tremendous support from both the Vitalité Health Network as well as the Public Health Agency of Canada to get to where we are today. Both agencies have provided innumerable support since the early days of this investigation back in 2023. They provided dedicated resources and expertise to help us in completing each and every step that I've outlined before. I'm hugely appreciative of the support and collaboration that we've received from these two agencies. Now, some have asked us, so why haven't we just gone ahead and just done the analysis at that point in May of last year with the information we collected to date? And so I'd like to just spend a minute to explain why we did this. So the physician raised concerns to us, concerns that we felt were important and needed to be explored. He asked for our assistance in understanding the significance of the findings, and we agreed to help him in collecting the information we thought was important to do that work. But before proceeding with the analysis, we need to make sure that the data is as complete and accurate as possible. This is not just a paper exercise. As scientists, we owe it to ourselves, to our patients, and to the physician to make sure that the data is as complete as possible so that the findings from the analysis can be relied upon. So it remained important to us that he reviewed the data to make sure that it was as complete and comprehensive as possible so that we would all have confidence in the results from this work. Having said that, today I'm happy to be announcing a few important updates to this work. Recent efforts have led us to receive a significant number of completed and verified patient packages. We now have completed and signed patient packages on 222 individual patients in hand, which we feel is enough to start the data analysis. I'm therefore glad to say that that activity is now underway with the support of the Public Health Agency of Canada. We expect that the data analysis phase should be completed in late April of this year. Also, a dedicated web page that's specific to this investigation should be coming live shortly. That web page will provide additional information on the objectives of the investigation, the work that we've done to date, where we're at, as well as next steps, including timelines around that work. I would encourage you to check regularly on that website for information and updates. On a complété plusieurs étapes depuis le début.
We have completed several steps since the beginning of the investigation to assist the clinician in gathering the necessary data to better understand the concerns he has raised. Today, I'm proud to announce some important updates on this work. Recent efforts have led us to receive several complete and verified patient files. We now have complete and verified records on 222 patients, so we believe we have enough data to begin the analysis phase. I'm proud to say that this activity is now underway, once again with the support of the Public Health Agency of Canada. The analysis phase is expected to be completed by the end of April.
In the data analysis phase of our investigation, I'd also like to outline the next steps in our investigation with some estimated timelines around that work. As I mentioned previously, we expect that the data analysis phase will wrap up in late April of this year. We'll update you once the data analysis phase is completed and we're moving into the next phase of the investigation. And we plan to do that by providing an update on our website dedicated to this investigation, as well as issuing a news release to let you know that we've reached that step. The next step after the data analysis will be the interpretation and scientific review phase. And we'll do two things at the same time. We'll send the findings from the data analysis to the Public Health Agency of Canada so that they can do their own scientific review of the findings. Internally here, we'll also start to interpret the findings from the analysis and start to think about any recommendations and next steps. We plan for the interpretation and scientific review phase to be finished by the end of May of this year. And again, we will update our website and issue a news release to let you know that we've reached that step. Once we've received FACT's review of the findings and their interpretation, we'll be able to combine our interpretation along with theirs into a report on the investigation. We plan to have this work completed and ready to share with you all later this summer. At that point, we'll update you several different ways. We'll issue a news release, as well as providing a briefing similar to this one as well, to share the findings, recommendations, and next steps. We'll also issue a public report on the work and the findings, as well as update the website. J'aimerais aussi clarifier nos prochaines étapes à ce point-ci.
I'd also like to clarify our next steps at this point. As mentioned, the analysis phase ends at the end of April. We will inform you of the end of this phase via a press release and website update. The next step will be the interpretation and the scientific review. We will have two activities in parallel or at the same time. We'll share with the federal agency for their review and interpretation, and we'll do the same at home. We'll share the end of this phase with you with a press release and an update of our website. Once we've received the review from the Public Health Agency of Canada, we will combine it with our interpretation and recommendations in a report covering the investigation. So we will have a press release and an update of our website, and we will publish our report. And we will also have a news conference, just like today's.
Many questions that some of you have had on the work that we've committed to. Even though this work has taken much longer than we anticipated when we started this investigation, we certainly remain committed to completing it and to consider what else needs to be done to help patients and their families. Before closing off, I do want to acknowledge that this situation has surely been difficult for many patients and their families. If you feel you need support at any time, day or night, our provincial mental health line is here for you. You can speak with a trained clinician who can provide you with support, as well as guide you to available resources you have in your community. They can be reached at 1-866-355-5550. Avant de terminer, je veux reconnaître que cette situation.
Before closing, I want to acknowledge that this situation has certainly been and continues to be difficult for many affected patients and their loved ones. If you feel you could benefit from support at any time, day or night, our mental health helpline is there for you. You can speak to a trained clinician who can provide support and help you find the resources you need. They can be reached at 1-866-355-5550.
Thank you, Dr. Legier. We'll now proceed with questions from the media. Each reporter will have one question and a quick follow-up. You have the right to pose your questions in the official language of your choice. We do have a limited time for questions, so we'll do our best. And just to let you know, I will be alternating between members and organizations of the media who are present in the room and those online. Nous allons maintenant procéder aux questions des journalistes.
We'll now proceed with questions from the media. Each reporter will have one question and a quick follow-up. You have the right to ask your questions in the official language of your choice. We do have a limited time for questions, so we will do our best. And just to let you know, I will be alternating between members of the media who are present in the room and those online.
In from CBC, please unmute your mic and ask your questions. Bobby Jean?
Oh, sorry, I didn't hear you.
My apologies.
Can you hear me?
Yes, perfectly. Can you please ask your question?
Okay, thank you. The initial analysis phase, could you please give a bit more detail about what exactly that will involve and who will be participating in that?
Sure. So, as I mentioned previously, this will be done in collaboration between staff from my office, as well as the support that we're getting from the Public Health Agency of Canada's Field Epi program. So we have a field epidemiologist who has been dispatched to New Brunswick to help support in that work. And that will involve trying to meet the objective, or the main objective of our investigation, as I outlined previously. So really trying to better understand the concerns that were raised from the physician with regards to the findings of elevated levels of certain environmental substances. So that work will mainly focus on trying to better understand those concerns that have been brought forward, to see if those are valid concerns as well that we need to explore further.
Ms. McKinnon? Ms. McKinnon, a follow-up? Ms. McKinnon, please unmute your mic and ask your follow-up.
Sorry, I didn't realize you had muted me again. Has the province secured the $5 million previously offered by the federal government? And if not, will you do that before the federal election?
So the current government has committed to exploring that funding, or the availability of that funding, further. We have taken steps to make a request to the federal government for having that funding available to us to use potentially in the course of this investigation, depending on the outcome of the findings from this work, or alternatively to potentially be used for other research into neurodegenerative diseases in New Brunswick as well. So that request has been submitted, and we're still obviously waiting for follow-up from them on that.
Thank you very much. Alexandre Boudreau, l'Acadie Nouvelle.
Hello, I would like to know, medically speaking, would you say that it was a mistake to conclude the previous investigation without investigating on the environmental causes? The goal of that investigation was different, and I believe it was appropriate at the time. There was no reason to believe that there were environmental causes that were at play at that time. The investigation had to be conducted step by step. It was important to follow the process. Of course, it started with the establishment of a possible common illness within the group of patients. I mentioned the oversight committee that was implemented to see whether there was the possibility of a common disease. Had it been the case, had the specialist said that, yes, we believe that there is something in common within those patients, then that would have triggered more work, more research to find the common causes, and the environmental aspects would have been part of that. Because there was no common illness, the next step was not triggered. So I believe that the work was appropriate. Could you please explain the role of your agency and of the federal agency in this work? So as I mentioned it in my speech, the province started the current investigation. It is still appropriate for us to conduct the investigation. The vast majority of the patients are New Brunswick patients. The reporting physician is a New Brunswick physician. I have shared updates on this work with my colleagues of other provinces throughout Canada. I do not think that there are other physicians that are reporting similar cases in Canada, so it is still appropriate for us to keep investigating. But like I said, the Public Health Agency of Canada has helped us a lot, given us a lot of support.
Post Media's Sarah Seeley. Please unmute your microphone and ask the question. Sarah, please unmute your microphone and ask the question. Avery McRae, CTV.
Good morning, doctor, and thank you for taking the time as I just pull out my phone real quick to make sure I get the question right. The big question a lot of patients have been asking is, why has the Public Health Agency of Canada not taken the lead on this?
So I'll repeat part of the answer that I just gave to the previous question. So we still firmly believe that this falls within the jurisdiction of the province of New Brunswick to continue to investigate. By and large, almost all the patients that have been reported to us are patients from New Brunswick or have a link to the province. This continues to be reported by mainly one physician in New Brunswick. I've had regular conversations with my counterparts in other provinces as well to keep them informed of the investigation as it unfolds, and as well to inquire whether they may have been receiving similar reports within their jurisdictions, and that hasn't been the case so far. So I'm not aware of any other province having any similar cases being reported to them. And no other province has necessarily requested the assistance of the Public Health Agency of Canada to intervene or to act. So I think for most of those reasons, I think it still squarely remains within our jurisdiction to continue to work on this investigation and lead it. Now, again, as I've highlighted a number of times, the Public Health Agency of Canada has been involved since the very early days of this work, throughout all the different steps that I've outlined to support this work. And certainly, depending on the findings that come out of this investigation, there will likely be additional work that needs to be done, and there may be a different role or a bigger role to play for Public Health Agency of Canada at that point.
It goes without saying, of course, patients wanted answers yesterday. Just what are you hearing from patients these days and their level of urgency in getting these answers?
Well, I think you're absolutely right. I think patients and ourselves would want answers already. We certainly expect that these types of investigations will take some time. It's certainly taken much longer than we had expected when we started out on this work. But as I've hopefully outlined to you all, there are a number of different steps that need to be done to be able to complete this work and to make sure that we have data that is complete and verified and that we can have confidence in, so that we can have confidence in our findings as well. So if we rush things too quickly, then we end up with results that are perhaps less reliable, and from a scientific perspective, that's obviously not what we want as well.
Thank you, Doctor. We're going to go back online. We are now going to go to Lindsay Jones with the Globe and Mail. Can you please unmute your microphone and ask your question?
Hi there, Dr. Legier. Thanks for taking our questions. Can you hear me okay?
I can, yes.
Okay, thank you. How I understand this is that by summer you'll have a report with answers as to what is happening with neurological patients. Is that the correct understanding?
Yes, that is correct. Yep. I've outlined some of the next steps that we have to do, which involve completing the data analysis phase, and then doing our interpretation of those results, sharing the findings with the Public Health Agency of Canada for their scientific review, and then pulling that all together, and then combining that into a report, which will launch publicly with recommendations and next steps. And yes, we do hope that will be ready at some point this summer. Again, some of those are timelines that we've put around that work that are certainly estimates and may be affected by by factors that are outside of our control, but that's certainly what we're aiming to achieve.
Mr. Jones, do you have
Okay.
a follow-up?
Yes, please. I'm still unmuted. Thank you. So there's, as you know, there's been a lot of controversy over the first investigation, and people raising doubt about many aspects of it, and how with the New Brunswick government still leading this investigation, and other people, including the former head of CHIR, suggesting that this should be completely independent and separate from government. How can you be how are you able to assure the public that this is going to be a more rigorous scientific study this time around when it is being led by the New Brunswick government?
So this investigation is certainly different than the first one. I'm hopefully have highlighted those differences during my initial speech. This time around, the concern that was raised by the physician who reached out to us for support was very specific to measured levels, elevated levels of certain environmental exposures among his patients. That was of concern to him, and we certainly agreed with that. And the work that we've embarked on has mainly been focused on trying to get answers around those specific issues. This investigation, as I said before, is very different than the first one. So I think I think that's an important part to keep in mind. And again, as I mentioned before as well, certainly once the work is completed, we expect that there'll be additional work that will need to be done as well. And there may be a bigger part or role to play for the Public Health Agency of Canada or other organizations.
Thank you. Hina Lam, Canadian Press.
Hi, Doctor. I was wondering, you have questionnaires and files on 200 patients now, right?
Yes.
But the number of patients is about 400 so far, or above 400. How were these 200 picked and reached, and why is it only just these 200?
Can you please repeat your question, maybe a bit louder in the mic?
Why is it that you have, how did you choose the 200 patients who were given the questionnaire? Why not all the 400?
So maybe I can sort of explain some of the numbers a little bit. To your point, I know some of that has been confusing to some. So we've received 392 what we call notifications to public health. So that essentially, I have the questionnaire here, so it'll give you an idea of what that looks like. So this is the one-page questionnaire. This is the notification. So you'll see it has patient information and demographics on there. It has a bit of area here, a place for some of the details, and a little box here where you could add, handwritten notes on the clinical aspects of it. And then the physician reporting, and then you check the box on which condition you're reporting. So it provides us with very limited information to be able to understand anything. It just says I have a confirmed case or a suspect case of a certain disease that's reportable. So we have 392 of those. We have now 222 completed enhanced surveillance forms. So those are forms that we've put together that has the important information that we would like to assess on these patients, which will allow us to get answers to some of those questions. So really, ideally, what we're hoping to get is that completed form on those 392. That's the requirement as well to submit that information. And that's what we've been working with the Vitalité Health Network to support Dr. Marrero in completing. Now, he's not there yet. He's completed 222. And with those 222, we feel that we have enough information now to be able to proceed with the analysis. Certainly, if we receive more, we may repeat the analysis if we get a significant number of additional forms submitted to us. So we may repeat the analysis as well to see if that changes our findings. But with the 222, we feel that we have enough to proceed with the data analysis and provide us with useful information at this point in time.
Okay. And the other thing I was wondering is, what is the condition of patients right now? Have a lot of cases deteriorated, or have they become better, or what exactly is the condition? Thank you.
Sure. We don't have the specific outcome or detail on each of those patients. The information that we have is, again, related to the tests that were done, and details like that. We haven't embarked necessarily on a detailed clinical review, so we don't have necessarily the status of each patient at this point in time.
Alex Villeneuve, Radio-Canada.
Merci.
Thank you. You answered it, but I would like to understand better. In the public forum for 4 years, there has been one question: is there a new pathological disease in New Brunswick? And the second question is, why are there so many people with neurological illnesses that are non-diagnosed? What are you trying to get answers to? The first question, the second, or both? I'm not sure I understood your question. So, is there a pathological illness, and why are there so many of them? What is your goal? What are you trying to clarify? I think that with your first question, is there a new neurological disease in the province? That was the goal of the first investigation that was completed in 2022. One of the tasks of the Oversight Committee was to find an answer to this question. 6 neurologists in the province looked at the clinical information of the patients, and we asked if, in their official opinion, there was a common disease, and they found that no, there wasn't. So there is no evidence that there is a new disease in New Brunswick. That being said, the clinician came back to us with specific concerns that needed to be explored because they were concerning to us as well. This is when we started the new investigation that was different from the first one. So the goals of this investigation are very different from the first one. So we are looking at the concerns about the test results that are elevated with some environmental substances. What is the significance of these findings? I would like you to tell me, how is the collaboration with Dr. Marrero and your team? We have worked very closely with Dr. Marrero since the beginning of the investigation. He is the one who told us about his concerns. We took his concerns very seriously. We told him about the data that we wanted on the patients with the sharing of this enhanced form. We worked with them to complete all the steps that have been undertaken up to now. So there has been lots of communication and work to this date. He has been working very hard to verify, to validate, and sign on the patients to make sure that we had complete information and to validate where we are now to proceed with the analysis. We keep having a good relationship with Dr. Marrero. We communicate regularly, and he helped us get where we are now.
Premier Holt told the media that at one point Public Health New Brunswick has asked Public Health Agency of Canada to take the lead in the investigation, and she said they refused. When did that happen, and what was the reason given for the refusal?
So I guess my answer to that would be, as the person who has led the investigation for the last year, I've not made any request directly to the Public Health Agency of Canada for them to lead the investigation, nor am I aware of anybody in my office making that request. We've certainly had regular communications with them on the support that they could provide to different aspects of the file, but we've not necessarily made a direct request to them to take over or lead the investigation itself.
Okay, we're going to go online to Kevin with the Toronto Star. Could you please unmute your microphone and ask your question, Kevin?
Good morning, Dr. Leger. Thank you for your time. I believe you said in response to a previous question that the vast majority of these cases are located in New Brunswick. I was wondering if you were aware of any cases from outside the province, and if so, where were they identified?
So out of the 392 one-page notification forms that we've received, I'm aware of 16 patients who are who their current address, I should say, that's been reported to us on that form is outside of New Brunswick, from 6 additional provinces outside of New Brunswick. So mainly the Atlantic provinces, so patients from Nova Scotia, PEI, Newfoundland, as well as Quebec and Ontario and Alberta, most of those being in Nova Scotia at this time. We do know that out of those 16, I think at least 6 of those have either current or previous Medicare numbers. So we know that at least for some of them, potentially more, there is some sort of connection to New Brunswick at some point in time.
Kevin, do you have a follow-up?
Yeah, I was wondering how you're collaborating with other provincial authorities to, I guess, get a handle on this situation.
So as I mentioned previously, the main collaborations that have occurred to date have been with the Vitalité Health Network, as well as the Public Health Agency of Canada. The extent of the involvement or relationship with other provinces on this issue has mainly been to provide or share updates on the file in terms of the work that we're doing, the purpose or the objectives, and where we're at this point.
Thank you. Anna with Global.
Hi there. What sort of factors are you considering in this investigation, and what can the 220 people expect during the investigation period?
So as I mentioned before, the main objective is really to help answer the concerns or provide further understanding on the concerns that were raised by the physician with respect to certain elevated levels that he's obtained on environmental substances that were measured. So that's really the main objective of the investigation that we'll be trying to further understand better. Certainly we'll be providing updates as the investigation goes along. So I think, again, for anybody who's interested in this investigation, for patients and their families as well, I've outlined what those next steps are and how we would be providing updates. So I would certainly encourage anyone who's interested to find out more about where we're at in the investigation and next steps to go to the website that will have all that information and be kept up to date.
I understand that there's more than 220 people you've received. I know that some people have also passed away. Is there any plans to expand this and potentially look into those cases of people who have already passed away?
If they've been reported to us, we'll be looking at that information as well. So if they have deceased, yes, it will be included in our review as well.
Thank you both. Sheldon with MBS.
Good day. Wondering, how will this analysis potentially lead to the source of exposure and environment?
I think that will may be part of next steps, depending on our findings. There's a lot of work that needs to be done to really understand the findings and the concerns that have been brought forward. So we need to explore many different elements of this to really understand the issue before we even go to the next step of saying, okay, we need to look at potential sources of exposure. So we need to look at the types of tests that were done. and whether those are aligned with best practices. So, for example, certain heavy metals are best tested through blood, for example, and others through urine. There are some samples that are a better indication or measure of exposure than others. So we need to make sure that the tests that were done are adherent or follow the best practice. Again, to be able to rely on those results, we need to see if the values that were measured are actually accurate. And again, we need to look at as well the levels that were measured, because again, finding something in a person does not necessarily mean the same thing as that being a risk to a person's health. We know that in our environments, through the air we breathe, the water we drink, the foods we eat, we're exposed to a variety of different environmental substances on a day-to-day basis. So finding something in a person does not necessarily mean that there is a problem or an issue there, or that it's causing a health concern, right? So we need to explore those further. Certainly if the findings of that review indicate that there are elevated levels of certain environmental substances among these patients that do potentially pose a risk to their health and may be higher than what we would expect to see in the general population, then at that point, one of the next steps may be, okay, so why is that? How are they being exposed? Where? And then we then proceed with that work. But again, we only get there once we've completed our analysis and interpretation of the results.
Sheldon, a quick follow-up, please.
Yes. Is there a spectrum of symptoms? Are people experiencing exactly the same level of effect?
Again, in relation to the objectives of our investigation, within this specific investigation, we're not doing a detailed clinical review, so we haven't collected that information. We've really focused on trying to answer the questions around the elevated results that were flagged to our attention and for which the physician asked for our support.
Thank you. Heidi from Global, please unmute your mic and ask your question.
Hi, thank you very much. You just referred to elevated levels in the test results, which is kind of what's kicked off this whole data review. What types of things were elevated? You mentioned heavy metals, but can we be more specific in terms of the types of heavy metals and also any types of chemicals?
Yes, so the two that were specifically raised to our attention or brought to our attention were heavy metals and pesticides, specifically glyphosate and its metabolites and glufosinate as well. So those are the main ones that were flagged to our attention. Now, obviously, as we've collected the information, we've looked at any other additional tests that were done as well to explore those. But those would be the two main categories that were brought to our attention.
Quick follow-up, Heidi.
Yes, I'm familiar with glyphosate, but what was the other one? Can you explain what that is and where it comes from?
Glufosinate, which is another type of pesticide.
Okay, thank you.
You're welcome.
Sarah with CTV, unmute your mic and ask your question, please.
Thanks very much. This sort of was brought up before, but I think a big thing that patients are wanting is to trust this investigation and to trust that it will yield the results that will help them. How can you, I mean, what's your message to the public and to patients that they can trust this investigation? Because some of them do still have doubts.
Thank you for the question. I certainly know that there have been a number of questions raised on this investigation. I think I've outlined before why I firmly believe that it still remains within the jurisdiction of the province to investigate. I think the only thing I can say is that, again, we have the best interest of patients at heart. We certainly want to get to the bottom of these concerns that were raised. We think it's important for the physician to understand what he's seeing. We think it's important for the patients to understand and to get answers on those unusual findings. We understand. We understand that it's taken more time than we would have liked, but we are committed to this investigation. We're committed to bringing it to an end as well. And again, this certainly doesn't mean that it is the end as well. There will potentially likely be other things that we'll need to do following this work. But we are committed to getting there and to supporting patients in that.
Ms. Plowman, a quick follow-up?
Yeah, and I think I think there are still people who would like to see the Public Health Agency of Canada lead this. And so you were asked, why are they not leading it? But why couldn't they lead it? Could they still take it over?
Well, again, I think I outlined the reasons why I think we've felt to date that we were still the most appropriate one to take the lead and the support that the public health agencies provided to date. And again, the findings from our investigation will likely lead us to more work being done, and there may be a bigger role at that point for the Public Health Agency of Canada to play in those next steps.
Okay, thank you very much, ladies and gentlemen. That concludes today's update. Voici la fin de notre mise à jour d'aujourd'hui. Merci beaucoup. Thank you very much.